when we renew the Elementary and Secondary Education Act. We will work with Congress to expand these reforms to all 50 states. Still, in this economy, a high school diploma no longer guarantees a good job. That's why I urge the Senate to follow the House and pass a bill that will revitalize our community colleges. Which are a career pathway to the children of so many working families. To make college more affordable. This bill will finally end the unwarranted taxpayer subsidies that go to banks for student loans. Instead, let's take that money and give families a 10. $000 tax credit for 4 years of college and increase Pell Grants. And let's tell another 1 million students that when they graduate, they will be required to pay only 10% of their income on student loans, and all of their debt will be forgiven. After 20 years and forgiven after 10 years if they choose a career in public service. Because in the United States of America, no one should go broke because they chose to go to college. And by the way, it's time for colleges and universities to get serious about cutting their own costs because they too have a responsibility to help solve this problem. Now, the price of college tuition is just one of the burdens facing the middle class. That's why last year I asked Vice President Biden to chair a task force on middle-class families. That's why we're nearly doubling the child care tax credit, and making it easier to save for retirement by giving access to every worker a retirement account and expanding the tax credit for those who start a nest egg. That's why we're working to lift the value of a family's single largest investment, their home. The steps we took last year to shore up the housing market have allowed millions of Americans to take out new loans and save an average of $1,500 on mortgage payments. This year, we will step up refinancing so that homeowners can move into more affordable mortgages. And it is precisely to relieve the burden on middle class families that we still need health insurance reform. Yes, we do. Now, let's clear a few things up. I didn't choose to tackle this issue to get some legislative victory under my belt. And by now it should be fairly obvious that I didn't take on healthcare because it was good politics. I took on healthcare because of the stories I've heard from Americans with pre-existing conditions whose lives depend on getting coverage. Patients who've been denied coverage. Families, even those with insurance, who are just one illness away from financial ruin. After nearly a century of trying democratic administrations, Republican administrations, we are closer than ever to bringing more security to the lives of so many Americans. The approach we've taken would protect every American from the worst practices of the insurance industry. It would give small businesses and uninsured Americans a chance. To choose an affordable health care plan in a competitive market. It would require every insurance plan to cover preventive care. And by the way, I want to acknowledge our First Lady, Michelle. Obama, who this year is creating a national movement to tackle the epidemic of childhood obesity and make kids healthier. Thank you. She gets embarrassed. Our approach would preserve the right of Americans who have insurance to keep their doctor and their plan. It would reduce costs and premiums for millions of families and businesses. And according to the Congressional Budget Office, the independent organization that both parties have cited as the official scorekeeper for Congress, our approach would bring down the deficit by as much as $1 trillion over the next 2 decades. Still, this is a complex issue, and the longer it was debated, the more skeptical people became. I take my share of the blame for not explaining it more clearly to the American people. And I know that with all the lobbying and horse trading, the process left most Americans wondering, what's in it for me? But I also know this problem is not going away. By the time I'm finished speaking tonight, more Americans will have lost their health insurance. Millions. We'll lose it this year. Our deficit will grow. Premiums will go up. Patients will be denied the care they need. Small business owners will continue to drop coverage altogether. I will not walk away from these Americans, and neither should the people in this chamber. So, as temperatures cool, I want everyone to take another look at the plan we proposed. There's a reason why many doctors, nurses, and healthcare experts who know our system best consider this approach a vast improvement over the status quo. But if anyone from either party has a better approach that will bring down premiums, bring down the deficit. Cover the uninsured, strengthen Medicare for seniors, and stop insurance company abuses. Let me. No. Let me know. Let me know. I'm eager to see it. Here's what I ask Congress, though: don't walk away from reform. Not now. Not when we are so close. Let us find a way to come together and finish the job for the American people. Let's get it done. Let's get it done. Now, even as healthcare reform would reduce our deficit. It's not enough to dig us out of a massive fiscal hole in which we find ourselves. It's a challenge that makes all others that much harder to solve. And one that's been subject to a lot of political posturing. So let me start the discussion of government spending by setting the record straight. At the beginning of the last decade, the year 2000, America had a budget surplus of over $200 billion. By the time I took office, we had a one-year deficit of over $1 trillion. And projected deficits of $8 trillion over the next decade. Most of this was the result of not paying for 2 wars, 2 tax cuts, and an expensive prescription drug program. On top of that, the effects of the recession put a $3 trillion hole in our budget. All this was before I walked in the door. Now just stating the facts. Now, if we had taken office in ordinary times, I would have liked nothing more than to start bringing down the deficit. But we took office amid a crisis, and our efforts to prevent a second depression have added another $1 trillion to our national debt. That, too, is a fact. I'm absolutely convinced that was the right thing to do. But families across the country are tightening their belts and making tough decisions. The federal government should do the same. So tonight, I'm proposing specific steps to pay for the $1 trillion that it took to rescue the economy last year. Starting in 2011, we are prepared to freeze government spending for 3 years. Spending related to our national security, Medicare, Medicaid, and Social Security will not be affected. But all other discretionary government programs will. Like any cash-strapped family. We will work within a budget to invest in what we need and sacrifice what we don't. And if I have to enforce this discipline by veto, I will. We will continue to go through the budget, line by line, page by page. To eliminate programs that we can't afford and don't work. We've already identified $20 billion in savings for next year. To help working families, we'll extend our middle-class tax cuts. But at a time of record deficits, we will not continue tax cuts for oil companies, for investment fund managers. and for those making over $250,000 a year. We just can't afford it. Now, even after paying for what we spent on my watch. We'll still face the massive deficit we had when I took office. More importantly, the cost of Medicare, Medicaid, and Social Security will continue to skyrocket. That's why I've called for a bipartisan fiscal commission. Modeled on a proposal by Republican Judd Gregg and Democrat Kent Conrad. This can't be one of those Washington gimmicks that lets us pretend we solved a problem. The Commission will have to provide a specific set of solutions by a certain deadline. Now, yesterday the Senate blocked a bill that would have created this commission. So I'll issue an executive order that will allow us to go forward. Because I refuse to pass this problem on to another generation of Americans. And when the vote comes tomorrow, the Senate should restore the pay-as-you-go. Law that was a big reason for why we had record surpluses in the 1990s. Now, I know that some in my own party will argue that we can't address the deficit or freeze government spending when so many are still hurting. And I agree, which is why this freeze won't take effect until next year when the economy is stronger. That's how budgeting works. But understand, if we don't take meaningful steps to rein in our debt, it could damage our markets, increase the cost of borrowing, and jeopardize our recovery, all of which would have an even worse effect on our job growth and family incomes.